Long lines for a shot in Toronto. The wait to get a vaccine longer now for those who were supposed to get AstraZeneca.
Moments before I'm about to get it in my arm, I get a message saying that it's not possible. Then, I was very frustrated.
It's because of a risk of rare but serious blood clots, about 1 in 60,000 in Ontario. Ontario says the remainder of AstraZeneca doses could likely be used for second shots and left the door open for mixing doses if approved.
We're also waiting for NACI to review the UK data where there has been intermingling of vaccines, AstraZeneca and others, to determine what should perhaps be the best second dose.
A UK study on the efficacy of mixing doses is expected in coming weeks. Preliminary results published today show it's safe with an increase of mild side effects. But the federal government wants to make it clear
all the vaccines that have been approved for Canada by Health Canada remain safe for use in Canada.
Manitoba stopped handing out first doses today, but is pushing forward with its second shot program.
As a result, the AstraZeneca that is still in the province now and the doses that will be delivered to us in the future will be held for second dose immunizations only.
Newfoundland, Nova Scotia, and British Columbia announced today they will also hold off on using the vaccine for the first shot. Those who rolled up their sleeves early on did the right thing, says this doctor.
850,000 Ontarians have gotten it. It has saved many of those people from going to the ICU. It has saved many people's lives along the way.
Ontario still has a stockpile of 50,000 doses of the vaccine, and there's 250,000 more coming next week. A firm decision on how to use them is yet to come. Magda Gebrselassie, CBC News, Toronto.
So listen, lots of numbers being thrown around here, so let's get right down to the essence of what's happening here. Dr. Menaka Pai is a hematologist in Hamilton. Dr. Pai, why is the risk of this serious blood clot issue appearing to be such a moving target? I mean, there are 8 known cases in Ontario with the risk pegged at around 1 in 60,000 compared to just last month when the risk was around 1 in 250,000. I mean, what's changing here?
Well, when people hear these numbers, these risks, I really want them to think of them as estimates. So as we get more shots in arms and as the cases of it are on our radar, so we're finding more of them in real time, that estimate of 1 in maybe 250,000 starts getting more precise and closer to the truth. And we end up with, I think, more realistic numbers. So numbers that are closer to 1 in 60,000 at this point.
And how much more do those numbers continue to change as we develop a clearer picture of exactly what the risk might be? I mean, is there sort of an upper bound that we're working with?
Well, we have really high quality data from the Nordic countries, and they found incidences of about 1 in 26,000. It's all about gathering more data and just honing in on that target of what the true risk is. My hope is that 1 in 26,000, if that's true, that is the high bound of this risk incidence.
But of course, mathematically, even 1 in 26,000 represents just a fraction of 1% of people with complications. So that's worth bearing in mind. Dr. Pai, thank you so much for your time.
Thank you.